The COVID infection rate here is the highest it's been since Christmas. The rise in infections, 1 in every 65 people in Wales had COVID in the first few days of September. It's put the health system under huge pressure. The country's leaders have warned 100 people a day will need hospital treatment in the coming weeks.
Until now, this rise has been manageable. But with the rapid spread of coronavirus in our communities, pandemic pressure on the NHS is increasing once again.
In Scotland, infections are soaring too, the highest since estimates began last October. Rising cases have prompted the country to introduce mandatory vaccine passports. More interventions have not been ruled out. In England, there has been no rise or fall in the number of infections. It's one less thing for doctors like Rosie Brooks to worry about. Next week, her surgery should be starting its winter flu campaign, but that's been put on hold until the government decides what to do about COVID boosters.
We haven't been told whether it's safe to give them together. In theory, it makes sense, but we need to be given the absolute sign-off on that. We can't just go ahead and do what we think is right.
What sort of pressure does that place on your surgery?
It's a lot more work. Once they've geared up to come in for a vaccine, it's nice to just get both done there and then.
The government says it's waiting for the JCVI to advise before making the call. The concerns expressed here are caused by the uncertainties, the not knowing, and they'll be shared in surgeries and clinics across the country. Patients are asking questions, and for now, there are no answers to give them. While Britain waits, other countries are making choices. The Prime Minister learning from his Chilean counterpart about their inoculation programme.
I think that you're now going to vaccinate younger people as well, is that right?
Yeah, we started with children, 3 years old until 11.
My goodness, right.
As the government fends off criticism of stalling, the rest of us have taken our first tentative steps back towards normality. The end of the first full week of a return to work for many people has passed. Key decisions to safeguard our futures have yet to be taken. Ashish, Joshi, Sky News.